If given the chance, would you save a life? Hi, my name is Blaze Roberts, and at 20 years old, I was asked this very same question. And at 20 years old, I made what became the most important decision of my life. And that's when I said yes to join the National Bone Marrow Registry. Now, some of you may be wondering, what is bone marrow? What is bone marrow's purpose? Well, bone marrow is the soft spongy tissue located in the inner osseous space, or the hollow center of your bone. And its chief function is the creation of blood and blood products such as red blood cells, white blood cells, platelets, and carrying stem cells. But why is there a need for a bone marrow registry, and why do we need more donors? Well, we need more donors and we need the registry because bone marrow is used in the treatment of blood diseases and blood cancers, namely leukemia. Leukemia is the most commonly diagnosed cancer in children. And we need the registry because blood cancer is such a prevalent disease. It's so prevalent that every hour, 6 people die from blood cancer. Every day, 480 people are diagnosed with blood cancer. 20 people an hour are diagnosed with blood cancer. And okay, so blood cancer is prevalent. It's a disease that is fairly common. But we have a registry in place already, right? Well, registry is in place, but out of all the population, only 2% are members of the National Bone Marrow Registry. 2%. Of that 2%, only 1 in 300 people are a potential match. That doesn't mean that they're the perfect match. That means, hey, your bone marrow's kind of like his bone marrow. And after undergoing additional testing and determining whether or not they're the best match, those that are determined to be the best match, only 1 in 430 will actually follow through with that donation after being designated as the best possible match. And to make the odds even worse for the patient, 75% of patients need a donor who is not related. That means that 75% are relying on the kindness of a complete stranger. The odds aren't stacked in their favor. And that's why it's so vitally important for you to make the decision today to become a member of the National Bone Marrow Registry, so that you have the chance to prevent one of those 6 that die every hour from dying. Oh, some of you may be wondering, or you may have heard, that the bone marrow donation process is painful. Well, I have personally donated bone marrow. I did it about 8 months ago in February, and it's not a comfortable procedure, but the pain is very mild, very manageable. In fact, for the ones who physically donate bone marrow through aspiration of the hips, or where they pull it out of your hips, recovery time, full recovery is 1 to 2 weeks. The pain is very mild. You're put under general anesthesia, and you don't feel any pain until you wake up. You wake up, you have a little bit of a sore back. And think about it like this. What's a little bit of pain? A little bit of temporary pain when compared to being a permanent cure for somebody's cancer. The fact that you can be the permanent cure for a little boy or a little girl who's been diagnosed with leukemia. Another concern people have is, I can't afford it. I can't afford the travel or the hospital bills. Well, travel, hospital bills, all of that is taken care of by the National Bone Marrow Registry through bethematch.org, which is the website they operate through. And there is no out-of-pocket cost for the donor, which is you, if you decide to register. Everything's taken care of. So how do you donate? How do you join the registry? You can join the registry by going to bethematch.org. The National Donor Marrow Program, or for military and DoD civilians who work for the federal government, you go to Salute to Life, which is a military-specific program that is operated underneath Be the Match and the National Donor Marrow Program. So I encourage all of you today, at the very least, go to that website, see what it's about, and hopefully you'll make the decision to say yes to saving a life. Thank you.